welcome to Neo Psychology with me, your teacher, Mr. Neo, the channel where I teach online psychology lessons for my wonderful students. Today, we're carrying on with the Psychopathology unit and we're looking at Lesson 7, the behavioural approach to treating phobias. Let's rock and roll. Starter. What phobias do your friends have? What could you do to support your friend with their phobias, right? This is essentially what we're going to be looking at today, right? We're going to be looking at two types of treatments that psychologists use from the behavioural perspective to treat phobias, okay? So, two learning objectives: show comprehension and apply knowledge of systematic desensitization, show comprehension and apply knowledge of flooding, and then the third learning objective is to be able to discuss and evaluate systematic desensitization and flooding as a behavioral approach to treating phobias. Let's start with the first one. So here we are in the unit. We've done two lessons on the definitions of abnormality. We had a look at phobias, depression, and OCD. Last lesson we had a look at the behavioural approach to explaining phobias, and we are here today. We are looking at the behavioural approach to treating phobias. Psychologists are interested in explaining why phobias develop, but also in understanding how to treat them. The specification identifies two behavioural methods used in the treatment of phobias. So the behavioural approach to treating phobias, the two behavioural methods used in the treatment of phobias are systematic desensitization and flooding. Let's start with the first one, systematic desensitization. In the exam, I would write systematic desensitization in full, first of all, and then brackets SD. And then from then on, just call it SD because it's just easier, so you don't have to write it multiple times. Systematic desensitization. Systematic desensitization is a behavioural therapy designed to gradually reduce the phobic anxiety through the principle of classical conditioning. If the sufferer can learn to relax in the presence of the phobic stimulus, they will be cured. Essentially, a new response to the phobic stimulus is learnt. The phobic stimulus is paired with relaxation instead of anxiety. This learning of a different response is called counter-conditioning. A fear response to an object or situation is replaced with a relaxation response. So, according to the behaviourist approach, you learn your phobias. You acquire or learn your phobias through classical conditioning, through association. You've learned to associate the thing you're scared of with fear or anxiety or stress or panic. Okay? So, this behaviourist approach is saying, if you can learn a phobia, you can unlearn a phobia. Now, it's the same principle. If you can pair, essentially, the phobic stimulus, the thing you're scared of, first of all, was a neutral stimulus and didn't have any response, but you associated and paired it together with fear and anxiety. So what they're saying is, well, you can counter-condition that. You can relearn that association with something else. You can relearn it with relaxation. So now when you see your phobic stimulus, whatever it is, let's say a spider, for example, instead of pairing the idea of a spider with fear and anxiety, you're pairing it with relaxation. And therefore, when you see a spider, the thing you're scared of, and now you feel relaxed, this is the opposite. So therefore, you are over your phobia. You have counter-conditioned yourself. In addition, it is impossible to be afraid and relaxed at the same time. So one emotion prevents the other. And this is called reciprocal inhibition, okay? They are opposites. Relaxed and scared are the opposites, right? So if you learn to be relaxed in the presence of your phobic stimulus, you aren't scared, okay? You're not afraid. So this systematic desensitization involves three processes, okay? 1, creating an anxiety hierarchy. 2, learning the relaxation techniques. And then 3 is the gradual exposure. Let's have a look. Number 1, The anxiety hierarchy. The anxiety hierarchy is put together by the patient and the therapist. This is a list of situations related to the phobic stimulus that provoke anxiety, arranged in order from the least frightening to the most frightening. For example, an arachnophobic might identify seeing a small spider as low on their anxiety hierarchy and holding a tarantula on the top of their hierarchy. And you'd have steps going up towards that, everything in between, okay? So remember, this is a gradual exposure, little by little. You start with something very low in anxiety and you work your way up to something that's very high in anxiety. The second step is relaxation. The therapist teaches the patient to relax as deeply as possible. And there are a few different techniques for this. This might involve breathing exercises, okay? I don't know why I need to tell you what breathing is. You know what breathing is. You're all doing it, right? Or alternatively, the patient might learn mental imagery techniques, okay? Okay, all right. I'm in my safe place. I'm in my happy place. I'm at the beach, right? It's a nice day. I'm relaxed. I can hear this ocean, right? Okay, I'm breathing. Mental imagery techniques, okay? Patients can be taught to imagine themselves in relaxing situations, such as imagining lying on the beach, or they might learn meditation. Okay, I'm feeling calm, I'm meditating, right? Or alternatively, relaxation can be achieved using drugs, such as Valium, okay? So those are a few different relaxation techniques your therapist might help you with when you're facing your anxiety hierarchy. They might say, okay, let's do our breathing exercise, or let's do our mental imagery, or okay, let's meditate now so we feel relaxed in the presence of your phobic stimulus, or here you go, take some drugs. Done. Right? And then the third part is the exposure, okay? Finally, the patient is exposed to the phobic stimulus while in a relaxed state. This takes place across several sessions, starting at the bottom of the anxiety hierarchy. When the patient can stay relaxed in the presence of the lower levels of the phobic stimulus, they move up the hierarchy. Treatment is successful when the patient can stay relaxed in situations high on the anxiety hierarchy. So, let's get this definition down, right? Systematic desensitization, right? What is it? Fill in the gaps, give it a go, 2 minutes. As a challenge, thinking hard, draw an image to illustrate the key term of systematic desensitization. Give that a go now, please. Otherwise, let's go through it now, okay? Systematic desensitization. It's a behavioral therapy designed to reduce an unwanted response, such as anxiety, to a stimulus. SD involves drawing up a hierarchy of anxiety-provoking situations related to the phobic stimulus, teaching the patient to what? To relax, and then exposing them to the phobic situations gradually. The patient works their way through the hierarchy whilst maintaining relaxation. Okay, here's the task. Give yourself 10 minutes. I want you to create a systematic desensitization therapy session. Write down how you would create the following. 1. The anxiety hierarchy. Create a hierarchy list of situations from least to most frightening, right? I want at least 6 steps. Relaxation. How will you teach your client to relax? Relaxation techniques. Can you do this for one of the following phobias? Arachnophobia, fear of spiders. Ornithophobia, fear of birds. Coulrophobia, fear of clowns. Or one of your own. Okay? If you're with a friend, maybe do this with them. If you've got a friend or a family member nearby, maybe give it a go. Do some role play. Create your anxiety hierarchy and then run through it. Okay? Right. What might this look like? Okay? I want you to make your own, but I'll give you an example. Okay? So let's say arachnophobia with spiders. Okay? The first step is to create the anxiety hierarchy. So I'd say, right, let's start with step 1. This is the thing that's going to be the least anxiety provoking. Step 1, let's say I'm going to show you a picture of a cartoon spider. Okay, that should be low in anxiety. A cartoon spider, here's a picture of a cartoon spider. How do you feel about that? Okay, right. Next step. Maybe I'll show you an animated GIF of a real spider. Okay, look, now it's a picture, but it's now moving and it's a real spider. How do you feel about that? Next step would be, for example, let's say I get a plastic spider, an obviously plastic spider that's just there, okay? How do you feel about that? Can you put it in your hand? Can you hold it? Okay, plastic spider. Let's say the fourth step is gonna be a remote control spider. Okay, so I've brought in a remote control spider and it's gonna be moving around and I can control it and it's gonna be moving around the room. That might cause anxiety for some people. Next step would be, let's say I get a real spider but it's dead. Okay, so I got a real spider but it's dead. It's a dead spider, so I got a real spider but it's dead. Maybe you've got to hold it, have a look at it. Next step I would say is bring in a real spider. Now, it depends on how many stages you want. Let's say I bring in a real spider, but I keep it in the box. Okay, so it's within the box. And then let's have a final stage where I open up the box and I put a real spider in your hand. Okay? Now, this is something that the patient and the therapist would agree to together. It would be the stages that they would agree to, whatever would fit your needs as the person that's got the phobia, okay? But it would be something like that, starting from low anxiety all the way to something of high anxiety. Now, it's a gradual process. Only when you're comfortable in one stage can you move on to the next stage. And this happens over many weeks and many therapy sessions, right? And then which relaxation technique? There are 4 different ones I taught you, right? Let's say, for example, do the breathing techniques, okay? Do a little role play. Okay, the first step, here's a picture of a spider. How do you feel about that? I feel okay, but I'm doing my breathing techniques. And once I feel calm in the presence of it, I'm going to move on to the next step, okay? I've got a video to show you what this might look like. This is someone with a phobia of cockroaches. Watch this video of a woman having systematic desensitization, which is a gradual exposure therapy for her fear of cockroaches. Let's have a wee look.
I am terribly afraid of cockroaches. When I see one, I become a different person. I sort of become paralyzed. My heart starts racing. I have trouble breathing, and I freak out everybody around me. And I think they are the grossest things on the planet. I met Dr. Ferrand, and he mentioned exposure therapy, so I thought I would try it. He's going to cure me of my fears of roaches.
So whatever happened that made you afraid of this, and I think we talked about this a little bit. You had a bad experience in an apartment that you were renting. It was infested with roaches. They were everywhere. You didn't really feel safe.
Yeah.
And before that, you weren't comfortable with them, but didn't have the same intense fear. Afterwards, now they're pretty scary.
Yes.
All right, are you ready to handle some fake roaches?
Yeah, okay.
All right, hand up. Ready? Okay. That's what I get.
So clammy. Okay.
You ready?
Yeah.
Okay. Okay, like
Oh my God.
All right. Okay. Okay, that was fine.
Oh.
That was fine. Yeah. No,
Thank you. So this was a really good first session. I felt pretty safe, but I was a lot more nervous than I thought I would be. And I'm having trouble like calming down, and then I discovered I was sweating a little. I can't decide if I'm stupid or like, or if this doesn't make any sense to me right now. I know it makes sense, but right now it doesn't make sense. They look different than I would expect them to.
How come?
I don't know. I guess I never looked that closely.
Okay. Yeah, that's kind of part of this too, is you get to learn a little bit.
Oh! Hello! Oh my God! Ew! Yeah, there's a lot there.
Yeah.
That's gross.
Would you like to take these guys home with you?
No!
Will you take them home?
Yeah, I'll take them home. Here's the roach. I haven't opened it yet. I've had it in my pocketbook for a week, so it's probably not going to be in very good shape. But we're going to explore. Okay, I can do this. You can do it.
So here's our friend, the roach, named Drogon, in his little Chinese food container right now, and he's crawling on this paper towel, and we're going to take the paper towel out. Have Julie handle the paper towel.
I really do feel trapped.
I'm going to do this very slowly.
Oh my god!
It's okay. It's just anxiety, right? So you can let that wave of anxiety come over you, and now, how does it feel to have your hand there?
Scary.
So Julie did a great job with the previous exposure, which was pretty challenging, and now we're actually going to have her go into this room here, and we're going to let a different roach out. I'm going to be in there with her at first, and then when she's ready, I'm going to come out, and we'll track your level of anxiety all along the way.
Ready, ready, ready!
All right.
Okay.
I think you've been in there for at least 5 minutes.
Okay, it's really hot.
No, it's really hot. You want to stop for now?
What I'm gonna do, I'm gonna cuff him.
Good.
Okay. I got you!
Julie's exposure therapy experience, I would say, is pretty average. She had a pretty normal course of treatment. She struggled with some things, but that's totally normal. And she was very brave. And overall, I think that she did a great job. She ended up in a place where she wanted to be. In a place where fear of roaches really doesn't impact her day-to-day life as much as it did before.
This experience with exposure therapy has been incredibly surprising. I really, truly, going into this, never thought that I would make the kind of progress that I have. I can't say that it was fun. I mean, it wasn't terrible all the time, but it was definitely hard. But I really can see the value in it, and I really feel like my life is going to be easier because of it.
And that was systematic desensitization. Identify one thing you learned about systematic desensitization. Why do you think learning about this is important? How does this apply in real life? Who is this information useful to? What questions has this raised for you? Right? Give that a go. Otherwise, I'm happy for us to tick off learning objective 1, show comprehension and apply knowledge of systematic desensitization. Let's move on to learning objective 2, which is show comprehension and apply knowledge of flooding. So the two behavioural methods used in the treatment of phobias are systematic desensitization and flooding. Now we're going to have a look at flooding. So remember, in the exam, they could give you a 16-mark essay on discuss the behavioural approach to treating phobias. Now remember, that's a completely different essay if they said discuss the behavioural approach to explaining phobias. Now it's one word difference, but everything you write might be absolutely irrelevant, right? You need to remember the difference between explaining phobias, which is the last lesson, and treating phobias, which is this lesson. Okay? Flooding. Flooding also involves exposing phobic patients to their phobic stimulus, but without a gradual build-up in an anxiety hierarchy. Instead, flooding involves immediate exposure, not gradual exposure, immediate exposure to a very frightening situation. So, an arachnophobic receiving flooding treatment might have a large spider crawl over them for an extended period of time. Flooding sessions are typically longer than systematic desensitization sessions. One session often lasts 2 to 3 hours. Sometimes only one long session is needed to cure a phobia. So this is the key difference now. Systematic desensitization is gradual exposure over a long period of time, over many sessions, okay? So it can happen over weeks and weeks and weeks, right? One session at a time, one stage at a time, gradually building your way up to the highest thing, okay? Flooding is one long session, 2 to 3 hour session, all in one go. You may only need 1 or 2 therapies sessions of that only, okay? So flooding is not gradual, it's an immediate exposure over a long session. How does flooding work though? Because those people that have got their phobias, they're probably thinking that sounds absolutely awful. How on earth is that going to help? Well, flooding stops phobic responses very quickly. This may be because without the option of avoidant behavior, the patient quickly learns that the phobic stimulus is harmless. So, in classical conditioning terms, this process is called extinction. A learned process, a learned response is extinguished when the conditioned stimulus is encountered without the unconditioned stimulus. The result is that the conditioned stimulus no longer produces the conditioned response of fear. So, let's say I've got a fear of bees, okay? My fear of bees stemmed from the time when I got stung by a bee, right? Previously, bees were a neutral stimulus. I didn't have a problem with bees, right? But following an incident, I got stung by the bee. The sting is the unconditioned stimulus, and that caused pain or anxiety, which is an unconditioned response. Now, the pain and anxiety that I felt when I got stung has been paired with the bee. So now when I think of a bee, which was a neutral stimulus, the bee is now a conditioned stimulus that gets the conditioned response of fear of pain, okay? Fear, pain, anxiety. Now, what this flooding session does, if I encounter a bee, but I don't encounter the sting, soon I should pair those two things together. I'm counter conditioning myself again. Okay, I'm learning that, this bee isn't actually harming me. This bee isn't stinging me. So therefore, I'm now pairing the bee with another emotion of like relaxation, which means that I'm counter conditioning myself, right? Now, in some cases, the patient may achieve relaxation in the presence of the phobic stimulus simply because they become exhausted by their own fear. Okay? At first, I would see the bee, I'm like, oh my god, I'm panicking, right? I've got so much anxiety, but the body has only got so much adrenaline, alright? Maybe it's got like 15, 20 minutes worth of adrenaline. Eventually, the body will become exhausted and you will become relaxed in the presence of your phobic stimulus. Eventually. Because remember, these are long therapy sessions, 2 to 3 hour sessions. And in the time when you've stopped feeling anxious and your body stopped producing adrenaline and you're feeling calm and relaxed, you will then pair that feeling of relaxation and calm with the thing you're scared of, eventually. Now, there are ethical safeguards to consider, right? Flooding is not unethical per se, but it is an unpleasant experience. So it is important that the patient gives fully informed consent to this traumatic procedure and that they are fully prepared before the flooding session happens. A patient would normally be given the choice of systematic desensitization or flooding, okay? Which would you choose? Would you choose the gradual exposure or would you choose the immediate exposure? Now, in the evaluation, I'm going to give you some more ideas about why you might choose one or the other because they do come with their strengths and weaknesses. Right, flooding as a therapy session. Complete the definition, write it down now, fill in the gaps, give it a go. Challenge, thinking hard, draw an image to illustrate the key term. 2 minutes. Give that a go now, please. Okay, flooding is a behavioural therapy in which a phobic patient is what? It's exposed to a what form of a phobic stimulus? An extreme form of a phobic stimulus in order to reduce anxiety triggered by that stimulus. This takes place across a long or small? A small number of long therapy sessions, okay? So it's a small number, maybe even one, but it's a long therapy session over many hours. Okay, so the point is, in a flooding therapy session, to create a scenario that is absolutely frightening, okay? So, I want you to create a flooding therapy session for one of the following phobias: arachnophobia, ornithophobia, coulrophobia, or one of your own. What will your session include? What will you do to push your client to their limits? Okay, right. Do your answer and I'll give you an example now. So for example, with arachnophobia, again, a flooding session, right? You really want to expose them to immediate exposure, right? We're not building up to anything gradually like in systematic desensitization. It's an immediate exposure. What would I do? Right, I might do something like I'm a Celebrity, Get Me Out of Here, where you turn up and they've got this big helmet that you put your head in. So you put this big helmet with your head in, and then you fill up the helmet with spiders. Maybe that would be a good idea. And then they'll be going mental, absolutely crazy, but 15-20 minutes later, they'll eventually start feeling calm, and then they would, eventually they would start to reassociate spiders with the feeling of calm and relaxation. Okay? Or if you didn't want to be so harsh, maybe I'll just get a spider and just put it on you, or put a couple of spiders on you. That would be a flooding therapy session. What will you do to push your client to their limits? And that is flooding. Identify one thing you learned about flooding. Why do you think learning about flooding is important? How does flooding apply in real life? Who is this information useful to? What questions has this raised for you? Okay, I wrote a joke. What's one form of behavioural therapy you shouldn't offer to a patient with a fear of swimming? Flooding. And that's learning objective 2, show comprehension and apply knowledge of flooding. Learning objective 3, to be able to discuss and evaluate systematic desensitization and flooding as a behavioural approach to treating phobias. What are some of the strengths and limitations of systematic desensitization and flooding? Right. First of all, it is effective. Research shows that systematic desensitization is effective in the treatment of specific phobias. For example, Gilroy et al. Followed up 42 patients who had been treated for arachnophobia in 3 45-minute sessions of systematic desensitization. Arachnophobia was assessed on several measures, including the spider questionnaire and by assessing response to a spider. A control group was treated by relaxation without exposure. At both 3 months and 33 months after the treatment, the systematic desensitization group was less fearful than the relaxation group. This is a strength because it shows that systematic desensitization is helpful in reducing the anxiety in spider phobia and that the effects are long-lasting. So one good thing is it is effective. However, systematic desensitization may not be suitable for all phobias. SD may not be appropriate against all phobias. Omen et al. Suggests that systematic desensitization may not be as effective in treating phobias that have an underlying evolutionary survival component. For example, fear of the dark, fear of heights, fear of dangerous animals, than in treating phobias that have been acquired as a result of personal experience. This suggests that systematic desensitization can only be used effectively in tackling some phobias. As we saw from the behaviourist approach last lesson, some phobias are acquired through experience, through some sort of traumatic event that occurred. But not all phobias have occurred or have been acquired through experience. Sometimes we have a phobia and we're not sure why, or we've always had it. So maybe systematic desensitization is only appropriate for those phobias that have been acquired through experience, through classical conditioning. So it's not suitable for all phobias. Some of those evolutionary phobias that we have, like it says fear of the dark, fear of heights, fear of dangerous animals, may not be appropriate to use systematic desensitization as the behavioural approach to treating them. However, one strength of flooding is that it is cost effective. Flooding is at least as effective as other treatments for specific phobias. Studies comparing flooding to cognitive therapies have found that flooding is highly effective and quicker than alternatives. This quick effect is a strength because it means that patients are free of their symptoms as soon as possible, and that makes the treatment cheaper compared to systematic desensitization. So, one strength of SD is that most patients would prefer it, alright, because it doesn't feel as daunting, it doesn't feel as scary or as traumatic, okay? However, one weakness is that it takes longer to do, alright? It's over many, many sessions over a longer period of time. Now, flooding is over many of sessions. They're longer sessions, but there's not many of them. So one strength of flooding is it can be quicker, and because it's quicker, it's cheaper as well, because you don't have to pay for as many sessions. So one strength of flooding is that it's quicker and cheaper. One weakness of systematic desensitization is that it's longer and more expensive than flooding. Okay. Furthermore, the treatment for flooding, the treatment of flooding is traumatic for patients. That's one weakness though. Perhaps the most serious issue with the use of flooding is the fact that it is highly traumatic experience. The problem is not that flooding is unethical because patients give their consent, but that patients are often unwilling to see it through to the end. This is a limitation of flooding because time and money are sometimes wasted preparing patients only to have them refuse to start or complete the treatment fully. If they start the treatment and don't complete it fully, they may end up with a phobia even worse than it originally was. Okay, there are 4 evaluative points. Can you summarize each evaluative point into exactly 10 words? One strength of systematic desensitization is research found it's effective. 10 words. And that is the evaluation. There we go. To be able to discuss and evaluate systematic desensitization as a behavioural approach to treating phobias. Yes, we've done it. We're moving on to the plenary. So there is a video for you to watch of a woman having flooding therapy or immediate exposure. It's for her fear of snakes, and she's in a room with this man who's got a snake. At the time, she's very scared of it. You can see in the picture she's really scared. But then, within a couple hours, she's holding the snake herself. Okay. And that is lesson 7, the behavioural approach for treating phobias. Okay, next lesson is going to be lesson 8. We're going to start looking at the cognitive approach to explaining depression. There we go, there's our lesson. Well done, my neo-psychologists. Great work today. I'm proud of you all. Keep up the good work. I've been Mr. Neo. God bless and peace.
I'm feeling like Will. I feel like a prince. I'm feeling myself. I'm loaded with bills, cause I wasn't blessed with no Uncle Phil. Don't know how it feels. I wanted to flex, they told me to chill. I'm making a flip. My life is a flick, now load up the film.